So now we're going to do a vascular examination, this time of the lower extremities. First, I'm just going to observe the extremities, look for any skin changes or changes in hair patterns, any cyanosis of the finger or the ankles or toes, looking for any, I'm going to go ahead and just observe the toenails, looking between each of the toes, and noting the nails and the skin color. And I'm also going to do a temperature check, so I'm just going to go ahead and go up. And get right there. At this point, I can also go ahead and observe the underside of my patient's leg. It's just, once again, looking for any changes. I'm also going to do the nail compression test like we did in the fingernails. Just compress down and making sure that it's coming, or changing colors. Looking for, that it goes from the pale to the more of this skin color, flesh color, which we're good. I'm then going to palpate the arteries. I'm also at this point looking for brawny edema. We can go ahead and just do that test now. So we press in at behind the medial malleolus, and then we can do the dorsum of the foot, and we can do the tibia. And they're springing back nicely, so we're not worried about that. I'm going to compare the pulses of the dorsalis pedis. Comparing them. And then posterior tibial. Good. And we can go ahead and do the popliteal. Just raise your knee. Okay. Okay, that's fine. This side. Okay, and those feel equal on each side. So now we're going to go ahead and do the femoral artery, which is between the ASIS and the pubic bone. So I'm going to go ahead and have you find your pubic bone. Okay. And then we're just going to feel the, well, you can go ahead and remove your hand. Okay, good. We're going to test it on this side as well. And then once I find it, I'm going to go ahead and also knit at the same time. So I'm just going to go ahead and place this right below that line right here. Okay, good. And I don't hear anything, which I shouldn't, so you're just listening for a breathe. And then I'm also going to palpate for the lymph nodes at this point. So horizontal along the inguinal ligament. Go. Okay. Once again, if I find any, they just want to be pliable and movable. And we can also at this point check for a hernia. So I'm just going to go right along there and then have you turn your head that way and cough. Okay. And then we're just feeling for the pressure changes and if there's any part of the intestines coming out, which there isn't. So that is good. And now we are going to do the, we know that. Now we're going to do, I think, Hoffman sign. So I'm going to just, this would be looking for a specific, if they was red and inflamed and had some kind of infection, I would lift their leg up. And then I'm going to just squeeze their calf and dorsiflex, and we're just looking for any pain, and it'd be like a really sharp, specific pain. Okay, any pain with any of that? Okay, good. And next we're going to do the leg elevation test. So I'm just going to raise your legs up, and once I'm done, I'm going to bring them over here, and you're just going to sit to the side. We're looking for the blood rushing back. So we're just going to lift your legs up like this. Go ahead and just relax. causing all the blood to drain down. Okay, good. Now we can go ahead and just maybe come over here and sit up. Okay, and now we're just looking for the blood to flow back down into the feet. Okay, which it is, so we are fine. And then next we're going to do the venous tap test. I'm going to go ahead and have you stand up. And then I'm just going to feel along to where the great saphenous vein comes along the medial side of the leg, and then I'm just going to come down to where the femoral vein meets up with that, and then I'm just going to feel here and then tap above, and I'm feeling for if I can feel blood go rushing back, meaning that the valves aren't working properly, and so I shouldn't feel anything